Good morning, everyone. My name is Paul Granillo. I'm the president and CEO of the Inland Empire Economic Partnership, and it's my pleasure to welcome you to this webcast. We're using a Zoom platform that is more presenter friendly. We'll be taking your questions via the chat, and you'll also have an opportunity to ask questions live. We're here today because the members of the Inland Empire Economic Partnership understand that when the economy turns bad in our nation, it turns especially bad in the Inland Empire. And we're very concerned about that. We want to make sure that we're doing the best to ensure that people in our region have jobs and that people in our region are able to have a high quality of life. But as we begin this webcast today, I think we need to pause for a minute. First and foremost, this is a healthcare crisis, and we need to realize that people have died, people are dying, and that there are people out there that are trying to take care of all of us. And so I just ask you for a second to pause for a moment of reflection. Thank you all very much. We want to make sure that everybody understands that, yes, this is a healthcare crisis, and we need to be paying attention to what we hear from the CDC, from the governor's office, and from our local county departments of health. We need to make sure that we are staying isolated, in contact with one another, but that we're doing that to ensure that lives are saved. And so we urge you to, again, follow all the directives that the government is putting out for us. So we want to turn now to the issue of the economic crisis that the COVID-19 crisis has caused in the world and in our nation. We're lucky at the Inland Empire Economic Partnership to be partnered with a group of great economists and researchers. I am personally grateful to them for the many hours that they have put into thinking about this issue of the economy, of helping us to put the survey into the field that many of you answered. We owe a debt of gratitude to these economists because they're doing this because it's the right thing to do. So I'm grateful to our chief economist, Dr. Manfred Kyle. Dr. Kyle is working, he's teaching a class, so he's not going to join us today. Our former chief economist, Dr. John Husing, Dr. Barbara Sirotnik from Cal State San Bernardino, Dr. Johannes Munoz from the University of Redlands, Cameron Shelton from Claremont McKenna, Dr. Robert Kleinhens, who together make up this group of fantastic researchers. So I'm going to turn it over to Dr. Sirotnik from Cal State San Bernardino, go Coyotes, and she's going to lead us through a presentation on the results of the survey. Dr. Sirotnik.
Thank you so much, Paul, and thank you for allowing us to be here and present some data that we've just recently collected. Before I launch into it, just since a lot of you don't know who I am, I'm a professor of statistics, not economics, so just wanted to be upfront on that, and also business analytics at Cal State San Bernardino. I'm also the director of the Institute of Applied Research, and since 1985, we've been collecting data for program evaluation purposes, community needs assessments, monthly economic forecasts. By the way, we did release our monthly economic forecast this morning. Surprise, surprise, it's way down. You'll hear more about that later if you wish. We do a lot of survey research, but this was an important one. We needed to take the pulse of businesses and find out, amidst this health crisis, what is happening to Inland Empire businesses. I want to acknowledge the rest of the team that Paul just mentioned. Very rarely in academia do we have a collaboration that is as good as the one that we seem to be forming here. They really are wonderful colleagues to work with, and therefore they get the hard questions after I present some of the data. They'll be helping to put the data into an economic context from their perspective. So launching in, why did we do this survey? Well, predominantly, most of the data that's out there happened to be old, February or earlier. And actually, there are the national unemployment rate stats that will be released this Friday. But even that reflects the situation on March 12th, which was before the shutdown. We needed something after the shutdown that says how are businesses feeling and what do they project for the future. The other thing is that there's a lot of data at the national level or the state level, or even the combination of Los Angeles, Orange County, Riverside, San Bernardino, whatever. We wanted to be specific for the Inland Empire, which is quite unique given our demographic profile, our emphasis in logistic industry, etc. So we wanted to take that information and send it over to you. I want to reflect the fact that this is just one point in time. It's our baseline, and we do intend to do some follow-up surveys. And hopefully that's going to help drive some of the policy decisions that will be helping our region's business community. That's the whole purpose of this. So what did we ask on this survey? It was an online survey to businesses in the region. We asked them what are their top concerns affecting the business, how long they can survive, really important question, based on the current cash flow and reserves without government support, changes they're implementing, ways that they can cope with this pandemic, some very specific things about estimates of percent of revenue that could be lost due to coronavirus, layoffs, etc. We got a reasonable response rate. I can't say it's a random sample. It's not. There was no way really of doing that, but given that we were only live for 1 week on this between March 23rd and the 30th, that was really a very, very good response rate. IEEP promoted it heavily, as did our friends in the press. So we are very grateful for that. There were surveys throughout the 2-county region, but there were a few cities that were a little more heavily reflected. Rancho Cucamonga, the combination of Murrieta and Temecula, Ontario, San Bernardino, Redlands, etc. So some of the cities were reflected a little bit heavier among the 203. Very important. We're really interested in the effect on small business. And we did get a lot of representation. 72% of the surveys were from small business, which we defined as less than 50 employees, 28% from the larger businesses. So that was really important to have a split. The larger businesses obviously account for most of the workforce, but smaller businesses, those are the ones that are potentially more at risk. So the first question was, can your employees work remotely? Well, overall, 39% of the people said, yeah, most or all of my employees could work remotely. Another 27% are saying some employees, but about a third are saying, no, it's not possible. What we wanted to do, though, is to take a look at the split between small and large, and there's definitely a split. If you take a look on the right-hand side, 42% of small businesses said it's just not possible to work remotely, versus 11% of the larger businesses. Well, given the call to self-isolate at home, given the need for social distancing and need for sanitizing anything, this is really important. The ability to work from home is important, and yet small businesses are saying that they really can't do that. We did get some interesting comments, and I wanted to split it up based on the type of organization, because COVID-19 is hitting different businesses differently. There are different challenges. So for service organizations, we heard from health-related organizations such as physicians and dentists and therapists. We heard from gyms and personal care organizations, hair, pedicures, etc. And what they're basically saying is they're getting their revenue from hands-on services. And they just can't do that without seeing patients in the office. Therapists, yeah, maybe they can, but others, no, they just really can't function. So they're trying to set up virtual consultations so that once this whole crisis is over, they can then kick in with the surgeries or procedures that need to be done. Manufacturing, they need their equipment. They can have a few working remotely, but most of them have to be on site. So some of the manufacturing firms commented that they're splitting their shifts, making 2 or maybe 3 shifts, so at least some of that social distancing can happen. Administrative staff, I found this kind of interesting. They tend to be able to work at home, but not necessarily the clerical staff. Clerical staff are not able to complete their tasks via telecommuting, says one, because they don't have laptop computers. I thought that was quite interesting. Technology is helping. There are some people that scurried around and over the last couple of weeks got the laptops that they need, got the technology that they need. One nonprofit even said, we worked really hard to get the technology needed to work remotely, so they're doing okay. Those that thought ahead, they're doing fine, but a lot of people just simply don't have the technology available to be able to work at home as they're supposed to be working. Entertainment industry, that's tough. The biggies, they can work from home. They have their microphone setups already. They can put on their shows. But when you have ensemble casts, there's just no way of doing that. There's no equipment. So they are losing out big time. Production, again, that's kind of similar to what I said about manufacturing earlier. They can do quotes, they can do some of their advertising, but they can't work at home. Something that I really didn't think about until the survey, union issues. Based on the union organization, some of the members cannot do their duties from home. That's the rules there. That could be theoretically an easy fix if the will was there, I would think, at least for some organizations. And then I found this interesting from an office firm. Well, productivity is going to be lost with employees working remotely. Well, I'm not sure that's necessarily all of that relevant at the moment. Any productivity is going to be helping. So hopefully we're not all worried too much about that loss of productivity. It's real, it's going to happen, but hopefully people can move on and not worry about that. Now, this slide was one that I thought was pretty much the most interesting, to tell you the truth. How long can your organization survive based on the current cash flow and reserves without government assistance? Well, overall, we have a median of 5.5 weeks, which means half the organizations can last more than 5.5 weeks. The other, they're going to be in trouble in less than 5.5 weeks. Some of the organizations said, oh, I can last as long as a year, no problem. So the mean is being pulled up by those people. The mean is the 10.9 weeks, but I think the median is a lot more real in this particular situation. Well, take a look at this split between small business and large business. Small business, the median is 4 weeks. How many of you out there really think that this whole crisis is going to be over in 4 weeks? And yet, median 4 weeks, that's how long they think they can survive without some assistance. Larger business, they're in much better shape, 12 weeks. Further, look at the bottom line. 25% of small businesses are saying, I can last 3 weeks or less, I'm in trouble. Larger business, they are saying 8 weeks or less. But the important thing is, at what point are these businesses going to have to lay off people, default on their loans, shut down, not be able to pay their bills? This is really an important slide right here. We also asked them, what is your planning horizon? Are they just hanging on for the ride, or what are they doing? Overall, 23%, almost a quarter of the businesses are saying, how can we plan? We're planning day to day. 37% are a little farther out, week to week. Another 37%, 2 or 3 months out. And 3% said, what planning? What can I say? Again, huge split. Small businesses, 31% of them are saying day to day, as opposed to large businesses, very few of those are in that situation. In terms of 3 to 4 months out, large businesses, we have 32% saying that that's their planning horizon, and very, very few in terms of small businesses are thinking along those lines. That's a real trouble spot. Moving on. We asked them about their changes in revenue. We know that some types of businesses are going to be losing while others actually are sort of benefiting through all of this. We asked if they could predict what's going to happen to their organization, specifically through the end of May. Well, most people are saying we're going to lose revenue. I don't think that's going to surprise anybody. 9% of the revenue said we should be pretty well stable. Businesses such as real estate, some of the non-food retailer, keep that in mind for what I'm about to say in a moment. Construction firms saying pretty stable. Truckers for port-dependent warehousing or food and drug stores or advertising, they're going to stay relatively stable. 5% said revenues are going to be increasing, and that's mainly manufacturers of essential products and people who can come in and do deep cleaning services or create those products. Real estate, well, some of them had said stable, some of them are saying increase in revenue. Same thing for non-food retailers. I loved this one. Manufacturers of toilet paper. Yeah, they're doing very, very well. Bottled water manufacturers. 15%, they're saying it's impossible to tell. Those are people in medical and dental offices. They don't know when they're going to have the personal protective equipment that they need to function. Turns out my husband is a dentist. He's one of those. He's closed down. He can't get all of the protective equipment he needs to be within inches of a person's mouth at this point. Commercial real estate market, nonprofits that depend on donations. They don't know when the health crisis will be over so that people will be feeling better about their own finances and go back to donating. Advertising, obviously, that's another one. Some very worrisome comments that I found. Although we're considered an essential business in the pandemic, we don't have the customer flow to maintain our revenues. They could go out. As a nonprofit, they depend on donations from businesses and grants from foundations. They could go out. Cities, they're supported obviously by sales tax revenue, and with closure of many businesses, that's going to be a problem. In terms of patient visits, again, medical dentist, CDC is discouraging elective visits because they can't get their equipment. And now, front page of the newspaper this morning, residents in Riverside County are being asked to wear masks. So that's fewer masks for the people that really need them. And then this one I found interesting. When we open our theater again, people are going to be reluctant to go back for approximately a year. So we're not talking about short-term shutdowns. We're talking about some real changes in the economy. So for those that said they were going to have a revenue loss, how much? Overall, 62% of respondents are saying they are going to lose more than 25% of their revenue. Again, big split. 73% of small businesses said that they expect to lose more than 25% of the revenue. That's only 24% of large businesses, but 73% of small businesses are saying that's how much they're going to expect to lose. Wow. Are they going to need to shut down? very blunt question that we had to ask to estimate what really is the severity of the problem. Well, the good news overall is that 63% are saying no, they're not considering shutting down within the short term, the next 2.5 months. 14% are saying they may shut down temporarily, but that's it. Then they'll be back at work. 3% are saying, I may be out of here. 20%, who knows? Again, I know I'm beating a dead horse here, but please take a look at the split up between small and large businesses. 21% of small businesses are saying, yes, I am considering shutting down. Only 6% are large, but 21% of small businesses. 86% of large businesses are saying no, only 53% of small are saying no. Big split here. Moving right along, layoffs. We asked, what percent of workers have you already laid off? Good news, overall, 62% are saying none. We're not laying off at this point. But 18% have already laid off 50% or more of their workforce. That's amazing. And among small businesses, 25% of small businesses have laid off 50% or more of their workforce. That's a huge amount. You can't function that way. They need help. What percent of workers are they considering laying off? Again, relatively good news overall. 48% are saying none, but 25% may lay off 50% or more. That's 33% of small businesses, but only 2% of the larger businesses. In terms of no layoffs at all, 62% are saying no layoffs in terms of large businesses, but that's only 43% of small businesses. Big split. And if they lay off their workers, will these workers get paid? For the most part, no. That's both small and large businesses. For the most part, it's a no. Almost done with the important slides here. We asked people, what are the top 3 concerns you see affecting your business? And it was a multiple response question, obviously. So overall, 89% said revenue, funding, cash flow, and that's no surprise. That goes up to 92% among small businesses, that's in the blue. 78% for larger businesses say that that's an important thing for them. Health of the employees, that's also a biggie. And I have to tell you, it did my heart good looking at the larger businesses. 86% said that health of the employees is one of their top concerns. And that absolutely did my heart good. I thought, oh, people are being altruistic. This is wonderful. Until I started looking at the comments. And the comments basically were, we need the ability to provide our service with limited staff if they're infected. Okay, well, that's real. They need to keep their business going. But in a way, it's sad. I had hoped they were actually concerned about their health. And some of them are. But some of them are basically saying we need the ability to maintain our service in the event of widespread infection. And that's why they are concerned. In any case, those are the top ones, revenue, funding, and cash flow, as well as the health of the employees. Obviously, there are other issues as well, but those are the biggies. They need government assistance, and they need it now. What are other concerns that people noted? Loss of the business. It was kind of heartbreaking to see things like, our hard work was invested in this business, and it's so sad to not be able to keep it. Again, this is a personal one. My husband, who has been in his dental practice for years and years and years, he's saying he wants to keep the practice open, just like a lot of his colleagues are. A lot of hard work. They need to keep going. Impacts of third-party layoffs. We need to have the services of other businesses that are closing. Big thing, they need the protective equipment. And this was a very interesting quote that I saw: without mandatory quarantine and other government assistance, we are being forced to work despite the risk of our health. Otherwise, they're going to be breaking the business relationships. That's huge. That's absolutely huge. So final slide. We asked people, what information do you need to be getting about coping with COVID-19? Sorry about that. IEEP is trying to provide that information. The departments of public health are providing it. Cities are. What do they need to know about? Well, big one, access to capital, especially for small businesses. A big one, mental health, how to cope with stress and anxiety, how to have their employees know how to cope with stress and anxiety, how to stop their clients from freaking out. Again, personal protective equipment, how to handle day-to-day decisions given uncertainty, and any government programs that can help. Information about loans and grants and business interruption insurance. Ongoing supply chain information, like when is all this going to be back online? Will there be continued curtailment? And how to support productivity of people working from home. So whatever information you folks can be providing, this is important stuff. So there's a lot of data in there. I scratched the surface. Hopefully this is helpful, and let me shut up at this point, open it up to questions, and request that my colleagues can help with the hard ones.
So thank you, Dr. Sirotnik, for laying out the survey results. Before we take questions, I want to call on some of our economist researcher team to just give their brief thoughts and opinions about the survey. Dr. Kleinhens, we'll start with you.
Okay, thank you, Paul. Good morning, everybody. These are tough times for everybody. Hopefully the survey findings that Barbara shared with all of us will help shed some light on things. I think the stark difference between small and large businesses in terms of their responses really caught my eye. And as I was listening to Barbara talk about these responses, I was jotting some notes down. Small businesses account for well over 80% of total establishments in the Inland Empire, but maybe about a quarter of jobs. But they're the ones who have indicated that they're at greatest risk. They're looking at revenue losses, and in the very short term, that is. So the government response that may be forthcoming is probably not really going to land here in the Inland Empire until maybe sometime a month from now, because it just takes time to get the apparatus up and working, to apply for things like loans and so on, and then to finally see that that cash flow coming in, or that assistance coming in. And so my immediate thought as I was listening to Barbara was that in that interim, which is really the month of April and maybe the first part of May, the real issue here is how will firms, especially small firms, be able to withstand the loss of revenue and still be able to pay their bills. And so it becomes ever more apparent that they're going to be needing to turn to their creditors to seek forbearance, if nothing else, for a few weeks, if not for a few months. And I think that that's probably something that is going to be so important to ensuring that small businesses in the region are able to hang tough and make it through these times. Not that the larger businesses and medium-sized businesses should be ignored by any means, but they do seem to, based on these survey results, they're telling us that they have a little bit greater resilience and ability to hang in there. The loss of jobs, the increases in unemployment are all things that are going to be forthcoming. We're just beginning to hear or see those kinds of impacts showing up in the numbers, but we really won't see them in full force probably until until May, when we start getting April numbers on unemployment rates and so on. So unfortunately, there's a bit of a lag in the timing with which we obtain information about what's happening in the economy. So we're a little bit in the dark right now. These survey results have really helped to shed light on what's happening in the immediate term here in the Inland Empire. I think I'll stop there. Thanks, Paul.
Thank you, Dr. Kleinhans. Dr. Husing, can we have your reflections? John, do we have you? Okay. Dr. Munoz?
Oh,
Oh,
I'm
there you
here
go.
now.
Okay.
Sorry, I muted myself.
Okay.
Um,
Your reflection?
yeah, essentially what I'm seeing here is we tend to divide the economy into one group of sectors, which are population serving sectors. Those are sectors where we're dealing with people pretty much directly. And most small businesses, that's what they do, whether it's restaurants or it's hair salons, it's gyms, whatever. So it's not a surprise to find them in particular trouble. The thing that worries me is a group that we can't really get to because there's no list of them, and that is single proprietors, people who work for themselves, who aren't easily identified, but they're the ones that are probably shut down entirely because they can't deal one-on-one with people. I happen to lift weights, and we finally decided to have my trainer, who I was meeting at a gym, come over to the house and work me here so that we'd at least have that. But I know that his income is pretty well shut off. His wife does a lot of work with women's beauty and things like that. She's shut off. And that's where we need, there is a clause in the bill that passed the House and Senate that does open them up to unemployment insurance. But the question is, how is that going to work? And right now, I don't think anyone really knows. I'll stop there.
Thank you, John. And I think that touched on Doug Kay from La Quinta's question. Dr. Munoz?
Thank you, Paul. There are just 2 points that I actually want to make here in the context of that survey. I think what we're seeing in this survey are 2 things aside from the actual data that I see as signals. Number one is we need to closely monitor specifically the financial sectors, because we need to make sure that what we're seeing right now with 50% of the small businesses not being able to pretty much survive much longer than 4 weeks, that this is not going to spill over into the financial sector and create a systemic problem similar to that we had in 2007 to 2009. That's number one. Right now, I don't think that there is a big issue because we started or we slipped into this recession out of a position of strength, but that can change over the course of the next month or 2. Specifically, since we're also expecting certain supply side shocks, meaning that once the stocks of essential goods are pretty much sold out, the price mechanism will kick in and those goods will be more expensive. The second thing that I'm seeing is we are at the moment where we see how the direction of the economic system that we've been living in for the last decade or even longer will change in its entirety. We see behavioral changes. We see technology adoption. We see that people don't want to go to the movie theaters for a year. Pew Research study said actually that people don't want to go to the restaurants even after flattening the curve for about 2 to 3 months, and they don't want to enter an airplane for 6 months. So this is even once we're out of this immediate health crisis, this will stay with us. People will change their behavior. They have done so in the past as a response to major shocks. And so wherever you stand right now with your business, please don't expect that we're going to be just going back to normal. There will be substantial changes in the way how people interact within this economy. Thank you.
Thank you, Dr. Munoz. Dr. Shelton, your thoughts?
Sure, Paul. So it's interesting that I follow on Johannes because I have some similar thoughts, which is how do we ensure that we can recover as swiftly as possible once the social distancing restrictions are removed is the question that's on my mind. And in some sense, it's about how we can preserve relationships that are interrupted so that they aren't permanently destroyed, right? Relationships between workers that come together at a certain business so that if they're laid off, they can come back hopefully relatively quickly rather than having to find another job, move away, et cetera. Hopefully prevent businesses from losing touch with their customers, prevent businesses from being unable to spring back because they have to liquidate equipment, break leases, file for bankruptcy, those sorts of things. And as my colleagues have mentioned, I think focusing on the flow of financial credit is going to be very important. But I would also hope that we would all focus on maintaining relationships. So not to gainsay what Johannes was just saying, I agree that there will be structural changes going forward, but we'd like to preserve as much as possible of the framework and structure so that we can spring back relatively quickly rather than having this be a prolonged effect once the shock is over.
Thank you. So if there are questions from our participants, we'll be glad to take those right now. You can put those in the Q&A or raise your hand. I've got a couple that have been texted to me. The first one is, I think, one that everybody wants answered, but probably the most difficult. And that is, how long before we get back to some type of normal? Open that up to all of our economists and researchers.
This is Robert. Let me just lead off by saying that what we're hearing at the national level is that perhaps the surge in COVID-19 cases will be experienced late in April. And yet each region is working with a somewhat different timeline, whether we're talking about the US versus California or here in Southern California, LA versus the Inland Empire. So I'm not exactly sure what that would look like for the Inland Empire, but nevertheless, if we're talking about the surge, the peak happening late in May, and then probably tracing out another 4 weeks, late in April, and then go another 4 weeks or so out before there's a sense that we've actually hit that surge and are on the right side of that curve. I think you're still looking at June before people begin to feel as though they can start to resume a normal course of business. And as a couple of my colleagues have pointed out, normal is in quotes. It's going to certainly be different for some period of time thereafter. And ramping up, I think, is something that would happen over the course of months, not weeks. And that's a likely scenario under best case scenario. And none of this is framed statistically. I'm just speaking in terms of what we've discussed as colleagues in our research. If it's measured in weeks, maybe we'd do better than that. But we're looking at several weeks of time before we can really sense that we're going to be turning the corner here.
Dr. Husing, there's a question about the impact on the warehouses so far. Can you take that?
Sure. As I'm looking at it, there are really two types of operations. One type are those that are dealing with e-commerce, and they're all having trouble keeping up with demand because we've all switched to buying online given the social distancing requirements. The other group are the more traditional warehouses that have essentially handled goods coming in from the ports. The ports are off substantially in terms of the amount of cargo coming in, so they're not doing as well. So I suspect we're going to finally see, when we get data, that the whole warehousing and distribution logistics sector, which has been powering our area more than any other, almost a quarter of all direct job growth last year came out of warehousing and distribution. And then it fed all these population serving jobs when people spent their paychecks at Stater Brothers or the hairstylist or whatever. So I think they're not going to do quite as well. It really depends on international trade through the ports, how it recovers. I think I saw, one of my colleagues can respond to this, that Trump has lifted the tariffs for 3 months, which would help somewhat on that aspect of it.
Okay.
That's correct. That's correct. Trump has suspended some tariffs for 90 days.
Okay. Doug Kay from La Quinta. The purpose of this survey was to give us an initial snapshot of where the business community is. We intend to continue to survey in the weeks and months ahead. Ultimately, this is to drive policy at the local, state, and national level. Doug has a good question here. He says, what other data do we need to be generating, tracking now to get our legislators the information they need to draft economic relief packages correctly for our region? Dr. Sirotnik, can we ask you to take a shot at that?
Yeah, I think that you've got a really good initial snapshot of what businesses need. And I think what we need to be doing is tracking over time to see where the pain is going. I think one of the most important things from a legislative point of view that came out of this survey was, what do people need? What information do they need? They need to know where to go to get the business loans and all of that good stuff. And then just track over time. I'm not sure what other data would be helpful other than that at this point.
Paul, this is Robert. The one thing I think we recognize, and we've really only scratched the surface with these survey results, is that there's no one-size-fits-all solution. We talked at length, Barbara showed all the details from the survey about how small businesses vary from large businesses in terms of how they're responding at this time. John pointed out that the small businesses are commonly in a set of industries that include like retail, healthcare, personal services like weight training, coaches and things like that, and so on. So the more we can inform elected officials about some of these fine points of where the pain is likely to hit, just knowing structurally what the economy, how the economy is configured with a prominent small business contingent and independent or self-employed worker contingent in certain industries as opposed to others, we may be able to help them to see where to expect problems to occur early on. And I think also we need to ask them to advocate on behalf of businesses to creditors, financial institutions, and so on, to be alert to what's happening with businesses and try to exercise forbearance wherever possible.
Paul, this is John. I think the single thing that would be really, really helpful is the federal government in the legislation said there were going to be several different kinds of things to help with credit, to help with proprietors so they could get some unemployment, etc. We need sort of take a sheet of paper that goes 1, 2, 3, 4, 5 on each one of those things that can be distributed to the various groups that are going to need that kind of help. I go back to, I was involved when my house was almost destroyed in Yucaipa with a massive flood that occurred back in 1969. And there were all sorts of relief agency policies and programs available, but nobody knew how to get a hold of them or do it. And I spent about a week putting them together, and then I got the son to basically take what I had researched and do 1, 2, 3, 4, 5. This is how you get an agricultural loan. This is how you get, disaster relief, etc. I think that is something that is going to be desperately needed in the hands of people who otherwise have no clue how to go about this.
Thank you, John. Larry McLaughlin is asking, we have an expectation that small businesses that must lay off workers will rehire quickly once social distancing is lifted. Can the panel comment on what rehiring or restart process might look like, i.e. time it'll take, availability of those workers when the time arrives?
This is Robert. I mean, I think it's largely going to depend on the sector, how they've, to the extent to which an individual sector has had to shut down partially or fully. And one would think that we're going to hear at some point that will be, there'll be an end date after which firms are going to be able to begin to resume, not immediately, but begin to resume normal operations. And we'll probably get advance warning of that measured in a couple of weeks or so. And during that time, I think the business, the employers are going to have to figure out just exactly what type of procedures that they're going to need to implement. And there probably will be a necessary health check related part of that procedure of bringing their current employees or their laid off employees back online and interviewing and hiring new employees. Beyond that, I'm not quite sure how to answer the question. I apologize.
I would think that it's very sector specific.
Yeah.
That is, one of the things that's going to occur is there's going to be an enormous pent up demand for certain kinds of services, barbers, hairstylists, that kind of thing. I mean, my wife and I have decided we're going to look like hell. We're not going to see anybody, so what's the difference? But ultimately, there's going to be a surge in demand. Another thing that's happening is, as a sector like logistics, though it will soften, will continue being fairly strong in a great part of it, there's going to be a lot of money sitting out there unspent that's going to hit once we open things back up again, which I think will be the good news for the population serving sectors.
I think it's important to realize that people cannot just, they're not leaving a job and jumping ship and going somewhere else. They're sitting at home unemployed. So I think that once things start opening up again, people are going to be very happy to be going back to those jobs. And again, the unmet demand is going to really hit. So I think people are going to be happy to get back to work.
So, Paul, this is Robert. Just one thing we have not talked about is the government sector. And so while property taxes apparently will have to be paid across the state, cities and county agencies that rely on sales taxes, bed taxes, and the like are definitely going to be taking it on the chin, and they're already stressed at this point in time to meet the demands of their their residents because of things like pension liabilities and so on that are also on their in their budget. So we haven't talked about that, and I know our focus here on this call is on business and small business in particular. That's something else that we'll have to look at in the future.
Sure. So, and Larry, I would just say that we are in the process of starting to survey our members because it does appear that there will be a ramp up back to doing business, but that certain protocols are going to have to be put in place. And so we're trying to get a sense from our business community, large and small, what they think they are and what type of workforce needs are going to come out of that as well. We're going to take the last question, which is from Robert, and that is about the stimulus package that has been passed so far, how that will affect the Inland Empire. So I'll turn that back over to our researchers.
This is John. It really depends on speed. I think what Robert said, probably the end of the month before we start seeing that show up. I think clearly, as I indicated earlier, the sooner we can show people how to get to the money, and the sooner the money gets to the financial institutions or the state agencies that will then recycle the money, the faster we will see the effect of blunting some of what's going on.
Okay.
I would
Agreed.
just like to add, this is Johannes, I would just like to add, we should not expect the stimulus to be pretty much a complete cover-up for the demand slump that we're seeing. Because at this point, it's unclear which of the Inland Empire businesses will actually be able to get access to the funds that are going to be distributed, and the same for the Inland Empire working population. So there are certain parts that will not see anything at all. For example, undocumented immigrants, whether you like it or not, they're part of the workforce here, and they may not see anything at all. And so, and the other part of it is really how quickly can the businesses then, with those resources, stand on their own feet. And that also goes back to the earlier point that was made, namely, what kind of sectors will recover first. And the ones that have a lot of personal contact may still see some reluctance before people go back.
Thank you, Johannes. Okay, so we're coming to the end of our time. A couple of things. Our team of economists will be doing follow-up surveys. We're grateful to all of you who answered the survey. We're grateful to our Inland Empire Chamber Alliance partners for helping to put out the survey. And just know that we will continue to do it because information in a crisis is key. We're going to be putting out a report. Our team of economists is working on that to go a little bit deeper into the survey results and also just to their some area sector-based research that they're doing. So you can look for that to be posted on a Friday. The leadership of the Inland Empire Economic Partnership, which includes many of our major businesses, the 2 counties and cities, are focused on making sure that we continue to maintain our job base and quality of life through a very difficult situation. And so we're going to be focused on economic recovery, workforce recovery, and research that helps inform those 2 goals. I'm grateful to our team of researchers and everyone who's participated today. For the press, if you have follow-up calls, we invite you to call our economists directly. Most of you have their contact information. If you don't, please contact us at IEEP. I think that's it for now. We look forward to continuing to be a source of information that can help us all together as an Inland Empire community focus on what needs to be done in the future. So take care, and we'll see you a little bit later. Thank you all.